Hello everyone, hope you're having a great day. My name is Ando, this is Eddie Leon and Jason Heinrich sitting next to me. We're Group 1 and today we'd like to present some facts regarding hormonal and antibiotics use in beef and dairy cattle, as well as our opinions for such a use and as to why it should be looked at with more accepting eyes. Before we go into more details, let's take a little look at the history of the use of hormones and antibiotics in livestock, specifically in cattle. As we all know, the world population is ever increasing exponentially by the minute. In 2014, it was estimated that some 795 million people are starving every day. That translates to about 1 in 9 people on this earth. And because of this, an increased food supply, especially of high-quality proteins, are more necessary than ever. In order to achieve this, increased livestock production is essential, as it will mean an increased supply with lower prices and more food availability for everyone. However, not all livestock species can grow and reach the right market age at the same time due to various factors such as size, diet, etc. We wouldn't expect a cow to reach market age as fast as a chicken would. What we can do, and should, is utilizing safe methods to increase production in these livestock species. In cattle, some hormonal supplements, both for beef, such as testosterone, estradiol, progesterone, and dairy, such as bovine somatotropin, are set out to do just this. Hormonal use was introduced and demonstrated before a panel as early as 1947 using diethylstilbestrol, or DES for short, in heifers. It was a subcutaneous implant intended for improved growth and feed utilization in these animals, and it showed a lot of effectiveness. By the mid to late 1950s, DES was cleared for general use in cattle. However, as time passed, some misuse cases revealed that it could potentially leave residue in the animal's liver. In 1971, it was discovered that DES was actually causing cancer in women and infants in utero, and so it was led to removal from 1972 to 1973 in human use, and being completely phased out as a livestock supplement in 1979. The only use for DES nowadays is in veterinary care under very low dose. Now by this time, other hormonal supplements and antibiotics were already being studied and tested, and the removal of DES only accelerated the process, which gives us the current market of today. It should be noted that all of these supplements will have to undergo rigorous investigation and studies done by the FDA through toxicology and withdrawal reports before they can be approved for legal use.
The FDA has specified qualifications for food production after multiple court cases, much like this one, for example. Many consumers during 1995 have accused the FDA of not keeping milk producers in correspondence with the regulations provided to them. The reason behind this is because milk producers like to use synthetic hormone called RBST. This hormone is used to produce more milk in cattle. The FDA did suggest that farmers could put a sticker saying non-synthetic milk, but only as a suggestion. Once it became public, many people were outraged and it developed into a court case. During this court case, the jury had ruled for evidence that the milk treated with RBST has any difference from natural milk. There was no evidence showing the milk produced from both sides were any different from each other. The ruling was in favor of the FDA and milk producers. They did not have to put any labeling if they chose to. The FDA has fairly simple guidelines to pass any synthetic treatment to animals. The synthetic treatment must have studies showing that human consumption is safe. Hormones cannot be harmful to cattle or livestock in general. They must also be effective in use with promising increase in profit and production, and must also have instructions for safe and effective use when given to the animal. An example of these specifications would be cattle implants. These cattle implants are in pellet form. It is put through the ear as shown in the diagram, and slowly dissolves through a growth hormone for muscles. There is no pain administered to the cattle, and there is a duration between each implant given for safety. Because this helps cattle gain more muscle, it helps the industry raise profit and production.
Here are some facts on hormones. HGPs, or hormones, are products that are implanted in cattle that slowly release small amounts of hormones to improve growth rates by 15 to 30%, feed efficiency by 5 to 15%, and carcass leanness by 5 to 8%. So basically this, when people use hormones, it gets what they want. So if they want more improved growth rates, then they'll put a different type of hormone. If they want a leanness, then they'll use a little bit less of a hormone. So that gets what the consumer wants if they want lean or a little more fatty. HGPs are based on naturally occurring male or female growth hormones, and they stimulate growth and improve feed conversion in cattle to above normal production levels. HGPs have been used by most major beef producing countries around the world, including mostly the US, since the 1950s. No evidence of any impact on human health during this time. So basically to now, they've not found any known facts that hormones are harmful for the consumption of humans, which is a big thing. Currently, 6 different steroidal hormones are approved by the FDA for the use in food animals. There's 3 synthetic and 3 naturally occurring. Here's some more facts on antibiotics. Antibiotics are used in animal medicine to prevent disease, which is important to the animal and human safety. Some farmers and ranchers choose to use inophores, which is a special class of antibiotics not used in human medicine. Those are used to promote lean muscle growth in animals, which results in leaner beef choices. That's just another thing that most consumers want. They want leaner beef when they go make a hamburger or anything else. All antibiotics must go through a lot of government tests and scrutiny before being approved for use in livestock. And they do a lot of tests to make sure before that gets on our tables we're not going to be getting anything harmful for our bodies. And even after they're approved, antibiotics are continuously monitored and they must be reevaluated annually. And so they only stay on the market if they are continued proven to be safe. So we can be sure that the FDA is going to be regulating this very well, and we won't get past what is harmful for the human to consume. There's a lot of concerns on hormones and antibiotic uses in cattle, and people think it's a lot not good for hormones in beef, and that they're unnatural and harmful to ingest. Also, some are concerned that the use of antibiotics can lead to superbacteria that are antibiotic resistant, and that will have future harmful effects, which is a big thing. We can't have a bacteria that's or a bug that's resistant to antibiotics, so that would be a big problem in the future. Here's just a hormone comparison chart. It just gives information on the amount of estrogen, nanograms of estrogen in specific food products that we consume. For example, in beef from steer-given hormones, there's 75 grams of that has 2 nanograms of estrogen, which is very low. And compare that to 75 grams of raw cabbage, and that has almost 3,000 nanograms of estrogen, and that's a lot of difference. And people think that beef with hormones has a lot of harmful hormones for us, which is not true, as this chart provides. There's other adult pregnant women. They have 90 million nanograms of estrogen, and that's a big difference. So basically, that's to give some information on hormones. Also, with using hormones, you got to think of it from an economic and business point of view. You get more bang for your buck, how you say, and this demand keeps going up for humans and how much the consumer gets in the stores, and we need to satisfy that demand. And to use hormones that helps us to satisfy it by getting bigger, faster, and meatier cattle, and that just is another thing from a business view. It's more better to use hormones. Also, when you when we have cattle in enclosed environments, that brings them all together, and it's easy for them to pass diseases to one another because they're all together and they're walking around each other's manure, and that helps disease to spread really easy. So that is a reason why antibiotics are very important to use when cattle are in a closed environment.
As for some final thoughts, it would be more personal stuff, but with the use of antibiotics on cattle, it saves their lives more often than leaving them in the natural world. They're more prone to disease rather than getting an antibiotic and helping them fight off any diseases that they haven't had before, much like a person. So antibiotics are useful with them, and I'm very pro with that. And
I just personally think the pros outweigh the cons a lot, and people are buying a lot more organic beef these days, and that's just due because they think that hormones and antibiotics used in beef cattle are not good for human health, and they're scared. And but really, in the end, it's not bad at all. It's all naturally occurring hormones. It's not overused at all. It's secreted very slowly, and there's no time from the injection of the hormone to the time you can eat it on the table. So that's virtually, it's all. And also another thing is it's the FDA that regulates it so much that there's no way they will let anything bad get on the market or in the cattle that we eat. There's also economic reasons. I mean, we have a growing population, and we need to satisfy the demand because people are going to be. We got more people. We got to feed them. So increasing production with hormones is the only way to do so. And every rancher uses animal welfare in what they do. They don't. I mean, when you think of using antibiotics, that helps them to prevent disease and to get sick, and that helps them live longer, and that's a good thing for animals. And people that grow up in cities, they're not really never stepped foot on a farm. They don't know how things work on a cattle ranch, and that's a kind of a problem because they think that everything that the media tells them is the truth, and that's not always true. I grew up on a farm, and I kind of know how it works. And it's once you grow up and you're around it, you kind of figure out more about it. So, yeah.
So in conclusion, while we do acknowledge and understand the consumer concerns regarding this matter, especially when the potential for catastrophic events stemming from misuse is very significant, superbugs are already a known phenomenon, and with scary implications at that, although it hasn't reached livestock production yet. We believe the positive aspects of proper hormonal and antibiotic use, as well as the necessity of using them to feed a growing world, far outweigh the negative ones. Technology has come a long way since its conception, and with its stricter and better tests to determine safety thresholds needed for safe human consumption, as well as more improved products on the market. If we, as consumers, are more willing to keep an open eye to the idea before just shunning it due to fears from bygone era, I believe personally that there will be much fewer issues with its implementation in our livestock animals. And this concludes our presentation. We hope you all have enjoyed it, and most importantly, gained some more knowledge, at least enough to make more informed decisions by yourself. Thank you for listening.